Dr. David Estin, and I work at Neurosurgeons of New Jersey in Monmouth County. Cervical disc replacement surgery is an excellent alternative in many cases to cervical discectomy and fusion surgery. With a cervical discectomy and fusion, a disc is removed that's protruding and compressing a nerve or the spinal cord, and is followed by a fusion whereby a cage or spacer is used to replace where that disc was and form a bony bridge between the bone above and the bone below. This is successful, but it decreases the range of motion of the spine, and it also increases the stress on the adjacent disc levels. So in the future, that could cause a herniation either above or below the index level. With a disc replacement, the same procedure is done, except that the spacer that is used allows for maintenance of motion at that level. It's not a fusion. And since there is no fusion, there is no added stress on the adjacent levels. It therefore decreases the risk of disc protrusion above or below the fusion and additional surgery. So in fact, a disc replacement operation results in a lesser chance of reoperation and a lesser chance of need for surgery above or below if there is herniation in the future.